Dysentery is an intestinal infection characterized by inflammation of the intestines, typically the colon, resulting in severe diarrhea with blood or mucus. It is often caused by bacterial, viral, or parasitic pathogens. The disease leads to a range of symptoms such as abdominal pain, cramping, fever, and frequent stools that may contain blood or pus. The condition can vary in severity, from mild cases to life-threatening infections if left untreated. Causes of dysentery. The two primary types of dysentery are bacillary dysentery and amoebic dysentery, each caused by different pathogens. Bacillary dysentery, this form is caused by bacteria, most commonly Shigella species. The bacteria infect the colon, leading to the production of toxins that damage the intestinal lining, causing inflammation, bleeding, and mucus production. The disease is highly contagious and typically spreads through contaminated food, water, or direct contact with an infected person. Amoebic dysentery, this form is caused by Entamoeba histolytica, a single-celled parasite. Unlike bacterial dysentery, amoebic dysentery is often associated with poor sanitation and hygiene, particularly in areas with inadequate access to clean drinking water and proper waste disposal. The parasite invades the intestinal lining, leading to ulcers and abscesses that result in blood and mucus in the stool. Amoebic dysentery can also cause chronic infections and may lead to complications such as liver abscesses if left untreated. Symptoms of dysentery. The hallmark of dysentery is severe diarrhea, which can include the presence of blood, mucus, or pus in the stool. The other common symptoms of dysentery include abdominal pain and cramping. These discomforts occur due to the inflammation and infection of the intestines. Fever. A high fever often accompanies bacterial dysentery as the body reacts to the infection. Nausea and vomiting. These symptoms may occur as the body tries to rid itself of the infectious agents. Dehydration. Frequent diarrhea can lead to a significant loss of fluids and electrolytes, which may cause dehydration. Symptoms of dehydration include dry mouth, excessive thirst, dark urine, and dizziness. Weight loss. Chronic or severe dysentery can cause weight loss due to malabsorption of nutrients and the loss of fluid. Transmission and risk factors. Dysentery is primarily transmitted through the fecal-oral route. Infected individuals can spread the bacteria or parasite through contaminated food and water, poor hygiene, or inadequate sanitation. The following factors increase the risk of contracting dysentery. Poor sanitation. Living in or visiting areas with inadequate sanitation facilities significantly raises the risk of dysentery. Contaminated food or water. Consuming food or water that has been contaminated by fecal matter is a common cause of dysentery. Close contact with infected individuals. Dysentery can be transmitted through direct person-to-person contact, especially in crowded or unsanitary conditions. Weakened immune system. Individuals with compromised immune systems, such as those with HIV/AIDS or those taking immunosuppressive drugs, are more susceptible to severe infections. Diagnosis of dysentery. Diagnosing dysentery typically involves evaluating the patient's medical history, symptoms, and laboratory tests. Stool samples are crucial for identifying the causative agent, whether bacterial, parasitic, or viral. In bacterial dysentery, stool cultures are performed to detect the presence of Shigella or other bacteria. For amoebic dysentery, stool examination can identify cysts or trophozoites of Entamoeba histolytica. Additional tests, such as blood tests or imaging, may be conducted to assess the extent of the infection and rule out complications. Treatment and management. The treatment for dysentery depends on the underlying cause. Bacterial dysentery, antibiotics are often prescribed to treat bacterial dysentery. Common antibiotics for Shigella infection include ciprofloxacin or azithromycin. The goal is to reduce the duration and severity of symptoms and to prevent the spread of the infection. Amoebic dysentery. Treatment for amoebic dysentery typically involves antiparasitic medications such as metronidazole or tinidazole. In severe cases, A longer course of treatment may be necessary to eliminate the parasite from the intestines and prevent complications. Symptomatic treatment: in both types of dysentery, rehydration is a critical part of treatment. Oral rehydration solutions, ORS, are recommended to replenish lost fluids and electrolytes. In severe cases of dehydration, intravenous fluids may be necessary. Dietary management: patients with dysentery should avoid greasy, fatty, or spicy foods. A bland diet, including foods like rice, bananas, and toast, may help ease symptoms while the body recovers. Prevention: preventing dysentery involves maintaining proper hygiene and sanitation practices. Proper hand washing, frequent and thorough hand washing, particularly before eating or preparing food and after using the toilet, can significantly reduce the spread of the disease. Safe drinking water from clean, safe sources and avoiding ice or untreated water in areas with poor sanitation can help prevent dysentery. Food safety: consuming thoroughly cooked food and avoiding raw fruits or vegetables that may have been contaminated with fecal matter is crucial in preventing infection. Vaccination: in some regions, vaccines for certain types of bacterial dysentery, such as Shigella, are in development, though they are not widely available. Conclusion: dysentery is a serious infection that can cause significant discomfort and complications, especially in individuals with weakened immune systems. Early diagnosis and appropriate treatment, including hydration and targeted antibiotics or antiparasitic medications, are essential to managing the disease effectively. Preventive measures, such as proper sanitation, hygiene, and safe food and water practices, are key in reducing the risk of dysentery, particularly in areas where the disease is endemic.